Good morning, and thank you for the opportunity to speak with all of you this morning. As you are well aware, the past year has been quite a rocky road for the 340B program, with a lot of uncertainty, from the orphan lawsuit to possible regulations. We have seen the challenges of the past year as a tremendous opportunity. We took a hard look at our performance and our priorities, and made some key decisions about what was most important for us for the future of the 340B program. As you know by now, we placed program integrity as our highest priority and followed through with that with dedicated resources and staffing to support it. HRSA has made great strides in advancing the program forward and enhancing our program integrity efforts. While HRSA withdrew its proposed omnibus regulation last year due to the orphan drug court ruling, we are moving forward in our goal to provide clear policy for all stakeholders. We are working on drafting regulations where we have explicit authority and guidelines subject to notice and comment where we do not. We have explicit authority for civil monetary penalties, for manufacturers and administrative dispute resolution. The CMP's Notice of Proposed Regulation is expected to publish in spring 2015 and will include calculation of the 340B ceiling price. The ADR NPRM is expected to publish fall 2015. Additional policies will then be addressed in the 340B Omnibus Guidelines, which we expect to publish in June 2015, including topics where we do not have regulatory authority, such as patient definition, hospital eligibility, contract pharmacies, recertification, audits, duplicate discounts, including Medicaid managed care, manufacturer limited distribution plans, and more. The guidance will be proposed and have a public comment period. It is important that all stakeholders review the guidance and provide HRSA with comments in order for us to assess the impacts on the community. HRSA made significant progress with the additional $6 million in funding for the program included in the FY14 Omnibus Appropriations legislation, which has enabled us to strengthen and build the program to ensure program integrity. We were able to develop a broader strategy around program integrity for entities and manufacturers and focus on improvements to our IT infrastructure and increase our staffing. We awarded 2 new contracts for IT work, and we are now fully staffed at 25. I would like to focus my presentation today on our progress to date and our priorities for 2015. To begin with entity program registration, when an entity applies for participation in the program, HRSA staff reviews and validates its eligibility based on statutory requirements. Starting last fall for hospitals, HRSA staff use information provided through automatic feeds of Medicare cost report data from CMS to ensure that the entity meets appropriate criteria. This automation allows staff to move away from the manual process we were using so we can devote more resources to working on the more complex cases. We also invested in additional staff to conduct regular quarterly eligibility reviews and to catch any potential compliance issues as early as possible in the process. We continue to work on the IT infrastructure necessary to integrate other federal IT systems. We also currently integrate with HRSA's electronic handbook and the Drug Enforcement Administration. We are working with others like CDC and Office of Population Affairs to automatically obtain eligibility information about their grantees, as this will decrease the possibility of an error occurring and reduce the staff time needed for manual checks. The requirement for hospitals to submit hard copy cost report worksheets has been dramatically reduced and completely eliminated in many cases, and several other entity types are expected to benefit from the integration of additional external data sources in 2015. In December, we launched a new version of the 340B database to help augment the various functions of the system to improve stakeholder transparency and utilization. The database has a completely new look and feel, featuring a simpler interface that modernizes the user experience. The database front page more clearly guides the user to appropriate choices based on the most common uses of the database itself, and HRSA continues to streamline on-screen instructions based on feedback from the user community. HRSA also continues to enhance the Medicaid exclusion file, which is the primary tool for preventing duplicate discounts. Fixed quarterly files were reintroduced in 2014, providing stakeholders with authoritative information on which entities were using 340B drugs for their Medicaid patients for a given time period. And we are responding to stakeholder feedback by adding additional fields and releasing archive files to the start of 2011. Once a year, all participating covered entities are required to recertify. Through the annual recertification process, covered entities verify that all eligibility information is up to date and attest to compliance through an 8-part test. Should a compliance concern come up during this process, HRSA staff follow up and investigate in a manner that tracks with other compliance activities, which I will touch upon in a moment. In addition, should an entity ever discover a compliance issue, HRSA has a standard process for reporting, known as self-disclosure, which may include corrective action and repayment to affected manufacturers. This information can be found on our September monthly update. For those covered entities that are eligible through a HRSA grant, including health centers and Ryan White grantees, there are now 340B related compliance elements in the site visits that those entities receive from their granting office. These elements include, for example, the ability to verify a covered entity maintains auditable records and policies and procedures to prevent diversion and duplicate discounts. Some covered entities will be selected for random audits or targeted audits in the case of a particular issue. All HRSA auditors follow a strict protocol. An entity receives a final report, but is granted the opportunity for notice and hearing, by which they can submit one written disagreement. If an entity submits a disagreement, HRSA considers additional points raised, which may result in adjusted findings. When an entity disagrees, it is critical that they include documentation supporting any claims that are contrary to the HRSA findings. Without appropriate documentation, HRSA is unable to fully assess the source of disagreement and would likely not overturn adverse findings. The entity is then issued a final report. If findings were included in that report, the entity is required to then submit a corrective action plan, as well as a public letter informing manufacturers of the potential need for repayment. To ensure the transparency of the audit process, HRSA then posts a summary of final audit findings, including the name of the covered entity on the OPA public website. Through findings and audits, HRSA is developing educational tools and resources in order to inform all stakeholders and improve overall program integrity. Some examples of the resources and tools include monthly webinars, call centers, and regular in-person trainings. The findings of the audits have varied. Some were very minor, requiring basic corrections in the 340B database. For example, contact or address information was incorrect. Other audits found diversion and duplicate discounts of 340B drugs, and those covered entities have repaid manufacturers. Also to date, we have not had to remove any covered entity or contract pharmacy from the program due to audit. However, for the first time, we just recently removed child sites from one hospital for failure to be on the entity's Medicare cost report and because the entity no longer owned and operated the child site. Finally, random audits are selected using a risk stratification methodology so that entities with higher risk factors are more likely to be selected for audit. In terms of audits since 2012, we've conducted 277 on-site audits that encompass over 3,290 outpatient facilities or subgrantees and over 8,500 contract pharmacy locations. Many have been finalized and are posted on our website. Covered entities should be constantly preparing for audit and ensuring their sites are in compliance. Some examples of best practices to prepare for audit include working with Apexis, attending 340B University, participating on peer-to-peer calls, researching the OPA and Apexis websites for the latest information, and the entity itself conducting an internal audit or having an outside party conduct an audit. All of these practices will assist entities in preparing for the audit and would likely have a better chance at positive outcomes. We are also actively engaged in manufacturer oversight. Per the statute, HRSA is required to collect information from manufacturers in order to verify the accuracy of 340B ceiling prices and then make ceiling prices available to covered entities. We expect to operationalize the system to provide prices by the end of fiscal year 15. This will also include spot checks of sales transactions. We will be using analysis of these sales transactions as an early warning system to conduct proactive analysis and trending of pricing data to assess manufacturer compliance. HRSA is also required to establish procedures for refunds and credits to covered entities, and we plan to address this in our upcoming proposed guidance. Finally, as mentioned earlier, we will be publishing an NPRM related to civil monetary penalties for manufacturers who do not abide by the law. These penalties would be levied when a manufacturer knowingly and intentionally charges covered entities more than the statutorily mandated ceiling price. Our expected timeline for issuing the NPRM is spring 2015. HRSA also has statutory authority to audit manufacturers. We review and follow up on all allegations brought to our attention regarding manufacturer compliance, particularly that manufacturers are not charging covered entities at or below the 340B ceiling prices, and ensuring that manufacturers are not discriminating against 340B entities. An audit of a manufacturer is currently in process in partnership with the OIG, and we hope to have more information on the outcome very soon. We are developing a protocol to move forward on additional manufacturer audits to be conducted in fiscal year 15. As we are gaining more information about compliance, it is critical to be able to track this information and put it to use. Therefore, we are developing a new IT system that will track information related to each covered entity. This internal system will link to our current database that tracks eligibility, creating a real-time feedback loop for our staff. The contract is in place, and we are currently working to build the system to fit our needs. Through our contracted prime vendor program, we have additional information on purchase and sales data that they may make available to us. This new system will be able to access the information regularly and mine the data to create an early warning system to flag covered entities that may be at risk for noncompliance. We have also ramped up our activities regarding our communication and outreach with stakeholders to relay the latest information about the program. For example, we publish monthly updates on our website, and HRSA now conducts webinars on hot topics to complement the work of the peer-to-peer program and 340B University. I encourage you to use the vast array of resources available to you to stay on top of 340B compliance. The 340B contracted prime vendor program managed by Apexis should be the first stop when you need answers to your questions, whether it's through their call center or by attending 340B University. You can get accurate and trusted information as we work with them closely on FAQs and education materials, so the right information is delivered. I started today by saying that we took the challenges of the past year to regroup, refocus, and pour our energies into improving the integrity of the 340B program. But while HRSA has regained some clarity on its path forward, I know that some uncertainty remains in the stakeholder community. I would urge you all to take this opportunity to look at your priorities for the 340B program and develop innovative strategies to achieve those priorities. As you know, there's a lot of activity and information regarding how the program should and should not focus moving forward. We are here to work with you to ensure that your implementation of the program complies with the statute and meets congressional intent. But you all have work to do to come together as a community around this program and find common ground by which the program can move forward and make improvements in the years to come. Thank you.